Elliot Colburn.
Pleasure to serve under your chairmanship, and can I add my thanks to the Honourable Lady from Oldham East and Saddleworth in securing this important debate. I think exemplified by the fact that my postbag has also been full of constituents asking me to come along, so I'm very grateful to her for securing it. I think the importance is also highlighted by the fact that on recent trends, it's estimated that well over 3,000 residents over the age of 65 in the London Borough of Sutton, which is where Carshalton and Wallington is situated, will be living with dementia by 2030. That's 38% higher than it is today. And living with dementia can be an incredibly scary and worrying time for somebody. And this also has an effect on family and friends as they watch somebody they love slowly deteriorate. My own family had to go through this with my grandfather, Derek, and it was one of the toughest times I think I've seen the family go through, because suddenly family and friends to somebody living with dementia suddenly find they're becoming carers first and family and friends second. And as time passes, as you start to recognise less of the person that you love, they sadly also recognise less of you. And the situation with dementia care was already incredibly challenging prior to the pandemic, and I think it has only exacerbated the problem. And as our other honourable members have mentioned so far today, the Alzheimer's Society has produced a very hard-hitting report entitled Worst Hit, Dementia During Coronavirus. And I do want to just highlight and repeat some of the pretty stark findings within that report, not least of which that 27.5% of all of those that have died from COVID-19 from March to June had dementia. And for the same period, dementia was the most common pre-existing condition for COVID-related deaths. For people who survived the crisis, the effects of social isolation were severe. 46% of people with dementia in their survey reported that it had a negative impact on their mental health. 82% reported a deterioration of the symptoms of dementia. And as has already been highlighted, 92 million extra hours have been spent by family and friends caring for a loved one with dementia. And 95% of carers have reported a negative impact on their physical or mental health. Now, the Alzheimer's Society has two key asks from government, one for the short term, as we continue to deal with the pandemic, and one longer term. The shorter term ask is very much to recognise the role that informal carers play in the lives of people living with dementia, which I think was very well outlined by the member for Bradford South. And the asks here, again, I'm repeating myself, but I'm repeating what other honourable members have said, but I think it's important, allowing for at least one informal carer per care home resident to be designated as a key worker with access to training, testing and PPE. Ensuring that delivery of carers' assessments and provision of short-term break for carers, and collecting local authority and health authority data on carer assessments and respite care. And longer term, I don't think it will be surprising to hear that the second recommendation is indeed around the long-term future of social care. And as someone that has a background in the National Health Service, it's something that I'm incredibly passionate about as well. I do genuinely believe that alongside the long-term plan for the NHS, there has to be a long-term plan for social care and how the two will be integrated. And this doesn't just need to tackle the cost of care, it also needs to tackle problems with the care workforce, including career pathways, recruitment and retention. Change is often unnerving, but to a person living with dementia, an upheaval of the likes that the pandemic has brought is nothing short of terrifying. And indeed, if my grandfather was still alive today, I'm genuinely not sure how either he or the family would have got through the last couple of months. So I do hope that the Minister will look very carefully at the Alzheimer's Society report and at the recommendations that they make.